if you're overweight, you try and have weight control. You get anti-inflammatory medications, and there are many of those that we've used over the years. And they seem to change every number of years as to which one we're using. But nowadays we find that the biggest ones that are being used is probably Advil and Aleve, which you just buy over the counter and just keep eating those. Physical therapy is helpful. Injections of cortisone, or there is injections of this hyaluronic material, which is a lubrication for the knee. And people who've had arthritis of the knee all have had that type of treatments. But then you reach a point where it's just not working, and you wait and you hope that it will improve. But the problem is that once that cartilage surface is deteriorated and the bone is rubbing against bone, you cannot replace that cartilage. We haven't reached that stage yet. If there's a small little, like a ½ inch defect in the cartilage, we can transplant a piece of cartilage for that. But the rest of your knee has to be good. But most of the time as you get older, the problem is that the whole cartilage surface deteriorates and you have to have a replacement. And that's why there are over 400,000 knee replacements done in the United States every year. Here's a picture of the knee, and this is interesting how you see the knee flexing, and we'll show you with the muscles and such. Now you also notice that there's some little wiggle in the knee itself. It's hard to see over here, but the knee is not just a plain hinge. Then we put in a new piece, and now it just goes smoothly. One of the interesting things about this rotating platform, and that has to do with the plastic piece that sits on top, is that the knee is not just a hinge. It's not just bending back and forward, but there's an actual little bit of rotation in the knee, and that's why we use this plastic type of thing that, see, it rotates, it has a little wiggle to it. And that's the important part that is involved with this particular type of knee that we're discussing here, which is the rotating platform. Now, the question is, when are you ready for a knee replacement? Does the knee hurt a number of days a week? And most of the time it's probably daily. Does the pain interfere with your sleep? Is it difficult to walk? Pain medications are no longer working. You can take Advil, Aleve, you can take stronger pain medicines, and it's still painful. Is it limiting you in terms of your ability to play golf, play tennis, or just enjoying many other activities? Is inactivity from knee pain causing you to gain weight, which is a problem, and then it gets worse. Now you're putting more pressure on your knee. And well, if you have knee surgery, you have to be willing to spend about 2 to 3 months getting over that. And you'll have to commit yourself to doing some rehabilitation. It's not that hard after. It is for a little while, but then it's a matter of walking, swimming, and exercise. Knee replacements depend on the many factors in terms of your weight, in terms of your general health. There are risks involved. If you have an infection in your body, you don't want to have that done. And there are problems that can occur. Knee replacements can loosen. You can get a fracture of your bone, and the components can wear. Now, the usual replacement that we've done for many, many years is the fixed bearing, which is the plastic piece that the knee rolls on is fixed into place. The new type that we're using, that I particularly use, is called the rotating platform. And what that does is as you're bending your knee and going up and down stairs or bending, the knee has a certain little rotation to it. And that little plastic piece is allowed to rotate. We'll show you in a moment what... Now, the rotating platform knee is, as you bend and as you